Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the May 19, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 37 new COVID-19 cases since Friday, May 15th. As of May 19th, Dubuque County has 287 positive COVID-19 cases. That's a rate of 296 per 100,000 population. No additional deaths are reported, so a total of 10 deaths have occurred in Dubuque County. 3,842 people have been tested in Dubuque County, and 7.5% of the cases tested have been positive. 17 individuals are currently hospitalized here, and 131 people, or about 49% of Dubuque County positive cases, have recovered to date. As of May 19, 2020, the state has a total of 15,337 positive cases. In all, there have been 107,582 individuals tested, or 1 in 29 Iowans. About 14% of Iowans tested have been positive. The 18 to 40 age group continues to be the highest number of positive cases category with 42%. 65% of the cases are symptomatic and another 22% are pending symptoms. The majority of cases continue to be male at 50%, and currently 383 cases are hospitalized. Finally, 8,006 or 52% of Iowans have recovered. A couple of things about the data I'll now be reporting. First, I mentioned that 65% of the COVID-19 cases are symptomatic, meaning they have cough, fever, shortness of breath, chills, muscle pain, sore throat, and or new loss of taste or smell. Then I mentioned 22% of the positive cases are pending symptoms. What does that mean? It means that at the time the person was tested, they were not experiencing symptoms. The person may have been tested at a Test Iowa site or was a contact of a positive case. However, they may develop symptoms in the next week or so. So as the contact tracing process monitors positive cases, they will be added to the symptomatic category if they do in fact develop symptoms. So just because they are pending symptoms doesn't mean they won't develop symptoms. The second new thing about coronavirus.iowa.gov website is that it is now reporting real-time numbers. In other words, as healthcare providers report positive cases and other information is reported to the Iowa Department of Public Health, they will be updated versus being updated once per day as was previously done. This is a great feature, but keep in mind the numbers I report to you every day, for example, will likely change in the hours after this report. The third new feature on the coronavirus.iowa.gov is results of serology testing. Serology tests are blood tests for antibodies versus the viral tests for the disease we report every day. Antibody tests check your blood by looking for antibodies, which show if you've had a previous infection with the virus. Depending on when someone was infected and the timing of the test may not find antibodies in someone with a current COVID-19 infection. You have to wait at least 7 days after you've been infected to be tested. Antibodies are proteins that help fight off infections. An antibody test should not be used to diagnose someone as being currently sick with COVID-19. To see if you have a current infection, you need a viral test, which checks respiratory samples such as a swab from the inside of your nose. A positive test results show you have antibodies that likely resulted from an infection with SARS-CoV-2 or possibly a related coronavirus. What we don't know yet is how long those antibodies will protect you. That is still being researched. We know that some infections produce antibodies that provide long-term protection, such as some of us who got the chicken pox, or vaccine-preventable diseases such as mumps and measles. But other diseases only provide short-term protection from their antibodies, for a few months, for instance. We also know that a person's ability to make antibodies is often unique to them. Antibody tests are another tool to help us understand disease activity, patterns of where the virus has been, and pockets not yet exposed. Antibodies also inform us that we have some degree of protection against COVID-19, even though we don't know for how long. The CDC will be starting a study this summer to examine COVID-19 antibodies in blood from donors in 25 metro areas over time. In order to understand the best ways to restrict the virus's spread, its likeliest outbreak sources, and the body's overall immune responses to the disease. We'll look for the results of that CDC study probably next year. Thanks for tuning in today. As I keep learning more and more about COVID-19, I think about Marie Curie's famous quote, "Nothing in life is to be feared, it is only to be understood." Now is the time to understand more so that way we may fear less. Let's all continue to be safe, be smart. When in doubt, don't go out, and remember, we're all in this together.